Magic 89.9.
89.9. Hello, everyone, and welcome back to your weekly dose of medical know-how here on Magic 89.9's Healthline. I'm your host, Tina Ryan, and we have a brilliant doubleheader lined up tonight. First up is joining us is orthopedic surgeon like Jada and I were mentioning earlier, and a forensic DNA profiler. Woo! Ooh, so excited. A real-life crime solver though, with scalpel. Dr. Rylan Flores joins us for the first hour. On the second hour, we have Dr. Patrick Paulo Abarquez. So please send me your questions as early as now. And maybe after this song or two, I will introduce Dr. Rylan because he's so excited. I can tell. We're getting along so well already.
Magic 89.9.
Okay, so here we go. 6:13 on Healthline. My guest is super ready. I'm very excited that he's here because first of all, okay, I had a really good intro and I lost it. Here we go. We're going to talk about bones and biology with a bit of mystery. Doc Rylan Flores, welcome to the Magic Studio. Hello, Doc.
Hello, Tina. Hello, everyone, and welcome to the show.
Okay, well, Doc, this is so exciting. This is the first time I'm actually meeting a DNA profiler.
Wait,
what is it? Okay. Ano ba talaga? Ano yung DNA profiler?
Let me qualify, okay? What you're trying to get into is that forensic thing, and that you're trying to identify what you watch in movies
Criminal
and
Minds.
TVs and Criminal Minds. Okay, so
I got
don't
too
do
excited.
that. I don't do that.
Okay, what is it that you do? DNA profiler.
Okay, first and foremost, I'm basically just a carpenter. I'm an orthopedic surgeon, but on the side, I do DNA profiling. It's basically looking into your genes and how your genes affect you and your lifestyle. That's basically it. Which means it's not testing, unlike when you want to know who's the father of this kid, or if you have, the likelihood of you having breast cancer and all of these things.
Okay.
That's not what I look at. I look at specific genes pertaining to inflammation, your heart, your blood vessels, your
and
fat
how do you
absorption,
do that?
all
Just
these
getting
things.
blood drawn? Ano ba yan?
No, they're actually scrapes underneath your cheek.
Ooh, okay.
And sent to the
scraping, guys.
laboratory. And then we find out what your genes are. You can't change that. But the question is, how can we modify so that we can get the better of it, granting your genes are good for you or not good for you?
Okay.
So that's what we do on the side. So as much as I want to, I don't do like CSI things.
Well, hindi tayo, ano ba to? Criminal Minds, guys. So, but how many of you guys, the DNA profilers are here in the country? Madami-dami na ba, Doc?
Marami-rami naman na. Across the country, I think there's like more than 50.
Okay.
More or less.
Oh, but still, that's just like a small
it's
number.
It's relatively, the thing is, examinations are kind of quite pricey, so it's not open for all.
Oh.
So there's just not that many who'd offer it, and just go for the standard laboratories, workups, and all of the other
So
things.
did you have to go to a particular school for that, abroad or
training
here?
abroad, yep.
Where?
Malaysia and Australia.
Nice. Okay. Okay. So as a DNA profiler, if ikaw ba, Doc, yung type na kunyari, I'm a patient and I'm like, I don't know what's going on with me, Doc. Something's not right. So I go to you, ganon. And then you take and then
We could look at that.
Okay.
We look into, it's like looking at a painting. Instead of actually looking at what the painting is all about, we look at the canvas and what's in it. So that's what we look into. We look at how you are, who you are, coming from mom and dad, because you don't have any choice. But it's a 50-50 thing. The question is, which 50% did you get from mom and which 50% did you get from dad?
Wow.
So that's the reason why even siblings might have similar DNA profiles, but may have some differences along the line because of that.
OMG.
And the environment actually plays a big role. I mean, where you stay, where you at, what you eat, and all of these things.
What?
So that's why you'd see siblings. You'd even see twins that they may be identical, but because one lives here, one lives abroad, that you'd actually see differences in the long run.
Okay.
It's because of that.
Oh, wow.
Your genetic profile plays a very big role.
Okay. If you have any questions for Doc Ryland, we're here at your service. Healthline 617 on the Magic. 863-10899 is the phone line. Or you can just simply send us a message on playback.tv/magic899. Hi to Steph, who's in the car with the kiddos, Stacy and Megan. So, how do you? Oh, hold on. So it's different. The DNA profiling that you do.
Yes.
Forensic.
Yes.
Okay. Way
because
different.
that one's testing. There's a difference between a DNA test and a DNA profile.
Okay.
So the test is like just what I mentioned. If you want to find out if the kid's yours or not, then you look into a DNA test.
Yeah.
If you want to look into the possibilities of you having a risk of getting, say, any carcinoma for that matter, for the breast, we look at BRCA1 and BRCA2 genes. Something like what Angelina Jolie did eons ago.
It's like profiling talaga.
That's the test.
Yeah.
The profile is you look into not just a particular gene, but you look at how its reaction with, or how it is in a particular profile with different aspects. Looking into inflammation, methylation and homocysteine that deals with your brain, and cardiovascular functions, even vitamin D receptors we get from the sun.
Okay.
Fat absorption, and all of these things play a very big role.
But you have to be a medical doctor to be a DNA profiler, or
yes, but there are actually those who aren't doctors who actually be able to help us: nutritionists, physical therapists, nurses. But they do just have to undergo courses for it.
okay. Well, with today's technology, do you think there are limits to a DNA? I mean,
Well,
DNA
for
profiling.
one thing, yes, in the country you do have some facilities that could extract the genes, but not that much. That's the reason why most actually are done abroad. They're not done here. That's why specimens are sent abroad.
Jack from Playback says functional medicine.
Functional medicine is a part of it,
Okay.
because that's one of like a branch of what used to be integrative medicine. So it's now a whole thing that they're divided into herbology, to functional, to alternative, to all the other things that are not traditional medicine.
Got it. Okay. Well, can you tell things like personality or intelligence from DNA, Doc?
Not personality, but the way you might handle stress.
Oh, okay.
We could
take
see
my
that.
DNA now.
Well, for one thing, whether I take your DNA now, I mean your profile, whether I take specimens now or later when you're a senior citizen or when you were a baby, it won't change much. It's practically the same thing. So
Oh, interesting.
that's who you are.
Okay.
That's who you are. And now what you do to yourself, that's what actually might add on to what you can become.
Oh, like you mean the diet and the stress.
All the things. Exactly.
Okay. And the environment.
Exactly.
Okay. Jack also asking, Doc, are you though from life science?
No, I'm not.
Ano yun? Wait, life
No,
science
it's one of the
is it a school?
laboratories based in BGC, but
Okay.
no, I'm not. I have friends there though.
Have you ever done a DNA test on yourself, Doc?
Yes, I did.
Did anything surprise you?
Well, one thing, there's such a thing that's called inflammatory reaction. It's inflamed. So whether you do good things for yourself, like you eat, you do exercise, things would get inflamed. But if you get sick, there's a problem, you have accidents, trauma, etc., there's also inflammation. The question now is, that's pro-inflammatory reaction. There's an anti-inflammatory reaction. The anti is your recovery. And I just found out for myself, I have not good genes for that.
Whoa.
When you look at the profile, they don't give you numbers or statistics or figures. What they give you are dots, like a traffic light. It's green, red, and yellow or orange.
Okay.
Green means that you have a beneficial gene for that particular SNP. And the red one is that you don't have a beneficial gene. The yellow or orange is not, the only difference is it's not like a traffic light wherein you can decide, will I go or will I not?
faster
So
or stop?
does that mean especially with NCAP now. We were just discussing it.
I know.
I was just listening to it earlier. But is it good or bad? Will it turn good or bad? No. It's still a non-beneficial gene. So the way we look at it in a particular profile, we look at how much. So it's not just one gene, it's how it looks with the entire profile and its relationship with other profiles as well.
Wow. So talagang connected.
What I found out is my anti-inflammatory, since they're non-beneficial, that means my recovery takes longer than a regular individual.
Ooh.
So before, I'd probably do bike or run or something. And then, when I get back from it, I notice why parang maghapon na and yet hindi pa ako nakaka-recover. In contrast
parang
to some.
pagod pa rin.
Exactly.
Okay.
Because my recovery takes a longer while than somebody who has probably beneficial genes for it.
Okay. And is that like an expensive test here?
Kind of.
It sounds expensive. That gave it away, ladies and gentlemen. 6:23 on Healthline. I'm Tina Ryan. If you just tuned in, Dr. Rylan Flores joins us this evening. He's an orthopedic surgeon and a DNA profiler. I have a spondylolisthesis, doc. That's why I'm standing up. People think that I'm just like, hindi ako napapagod. No, it's just better for my back. It feels better than sitting down. So, but at my age now, doc, I feel bad because I've wasted 20 years of not strengthening my core.
Okay, before you go down and become depressed with what you say, first question, when were you diagnosed with spondylolisthesis?
2001.
2001.
Grade 2.
Okay, for the benefit of
Please
of the
explain to
listeners.
them what spondy is,
So
spondylolisthesis.
high-tech spondylolisthesis. Anyway, it just simply means that there was a dislocation or a subluxation somewhere along the line in your spinal or your vertebral column, the bones that handle and cover up your spinal cord. So if you look at it on an x-ray, for some who's actually seen an x-ray, you see white things. I mean, they usually just see that in Halloween, diba? So anything you see on an x-ray is bone. So if you look at an x-ray, say, for instance, of the lower back, you'd see these kind of hollow blocks type of bones. One stacked up, one after the other. If you look at it, they're supposed to be aligned with each other. Spondylolisthesis means that it isn't aligned and it depends on how much misalignment there is from 25, 50, 75, 100%. That's why you have the grade 1, grade 2, grade 3, and grade 4 spondylolisthesis. I would presume, because I don't think you did any surgery or anything.
Not yet, doc, because I'm super scared.
Okay, wait. Let's talk about surgery later on. But right now, it's that it doesn't necessarily mean that just because you have spondylolisthesis, you automatically need surgery. The fact you're literally dancing right there doesn't equate to an automatic indication for a surgical procedure. So the question now is, that's why I asked how long ago were you diagnosed? Because 2001, heck, it's 2025 already. Which means at one point in time, I'm sure that joint that is subluxated or somewhat dislocated have
Graduate
actually,
na, doc.
no, they've actually healed in place already.
Oh, no, I don't think so, doc.
Okay.
Because it's still painful.
I was going to get to that. We were just talking about the spondylolisthesis, and it depends on what level it is. But there are always three things in the spinal area. You have your muscle, you have your bone, you have your spinal cord. Sufficing to say, seeing you up and about right now, spinal cord may not be that affected. Yes, you do have a spondylolisthetic portion, but like I said, hopping, skipping, jumping, and dancing right now.
Well, I haven't done a marathon ever, but I'm still
Marathons,
moving.
we'll talk about that later. But for this one, I don't think that's the problem, which leaves us the muscular area. Because we don't stop moving.
Yeah.
We move for work, we move to go to work, we move beyond work. So there's still that muscular layer. And 85% of the time, it's the muscles that give you a problem, not so much whether it's bone or spine. Why? Because your problems are in the back.
Yeah.
If your problems with the spinal cord usually may not even be felt in the back.
Yeah.
They're felt way down, all the way down to your toes.
Nice. Okay.
So with that, there's usually two things that need to be done. The irony is you have to strengthen these muscles.
Yeah.
And exercises play a very big role. Unfortunately,
Ano yun, Doc? Nakakain ba yung exercise?
how I wish. But unfortunately, before you can actually do these exercises, you have to rest and decrease that inflammatory reaction first.
There you go.
So the reason sometimes most would feel pain is because the misconception of, ay kasi tamad ako, ayokong gumalaw, ayokong kumilos, so I'm now gonna exercise because I'm having back pains. No, it's supposed to be reversed.
Yeah.
You're having back pains, the best thing you could do is simply just lie down, have a hot water bag over it, and stay put.
Okay.
And then when you're good to go and okay the next day or two, that's when you start to do your exercises.
Okay, Doc. This question is legit because I feel like it's a struggle for me to get up in the morning. Like the back pain is so...
I was gonna say, everyone's struggling to get up in the morning.
No, but bakit sa umaga siya pinakamasakit? Is it because of my sleeping position?
Actually, more than the sleeping position, it might be your bed.
Okay.
It might
I
be
like a firm
okay.
bed though. It's bad? It's bad for spondy?
No. Okay, let's put it this way. First and foremost, we're talking about beds. Let's put yourself as though you were your cell phone.
Okay.
At the end of the day, it turns red. You're kind of, oh my gosh, it's red. It might turn off.
Yeah.
So what do? You plug it in to charge it. That's what sleep is all about. That's what resting is all about for our bodies.
Okay.
So when we sleep, when we rest, when we wake up the next day, like your cell phone, unplug it, that's 100%. You're supposed to be at 100%. But with what you're saying right now, if you're not feeling good when you wake up, then there's something wrong. Whether it's how you slept, your position in sleeping, or what you were sleeping on. That's why the bed plays a very big role.
Ooh.
So, one, don't sleep on a hard floor, on a table, or anything, because sometimes they tell you, especially the older ones, that, you have a problem with your back, sleep on the floor. Don't.
Bad. It's
Don't.
okay.
You're
Okay.
supposed to have a cushion.
You guys are listening to an expert, orthopedic surgeon here. Okay, there you go.
So, because if you sleep on a hard surface, remember we do have bony prominences. So, like, what are bony prominences? Literally, mga buto na nakakapa mo on your sides,
Okay.
on your back and everywhere else. So, if you sleep on a hard surface, you end up having these areas contused. So you'll have more pains. That's the reason why you need to have a cushion.
Yeah.
Okay, the problem is with the cushion. How long is that cushion? How long has it been that you've been using that cushion of yours? Has it been a year or two? 10 years? 2 decades?
Yeah.
So now, the problem is your bed has stayed in place for the past several years or even decades. So that means you sleep on that same position every single night for the past several, who knows when.
Yeah.
So, no matter how good that bed is, you might even have a good, one of those highfalutin, high-tech, and expensive beds. But if that's the condition, you'd have some form of a memory on that cushion of yours.
Okay.
That alone can give you pain. That's the reason why we do recommend to rotate your bed.
Yeah. Every when?
Okay. Well, every month or every other month. But why do you need to rotate your bed? Because if that's where your position is every single night, I cannot ask you to be on the opposite, like you put your head where your feet is supposed to be and put your foot where your head is supposed to be, because that's unphysiologic. You will never be able to go to sleep with that because it's not comfortable and you're not used to it.
Okay.
So instead of shifting you, we shift the bed. So we rotate it. And then if you can flip it and then rotate again. And that can be done every month if you can. If not, at least every other month.
I hope you guys are taking mental notes, okay?
But don't do it on yourself. I mean, by yourself.
Mabigat.
Because I know, right? You're going to have more back pains.
But do you recommend for people also? I mean, I'm sure I'm not the only one with back pain. Do you recommend like those memory type of foams, Doc?
You know, right now, like I said,
what do you sleep on?
regardless, well, I sleep on a regular cushion.
Okay.
Although I
Is
put
it
this,
spring or
no, the foam,
okay,
the foam
the foam,
one. But
okay.
I do put this. How'd you call that?
Topper.
The mattress toppers.
Yeah,
'cause
the
it becomes really
toppers.
soft. It's so comfortable.
Alright.
That's why you don't want to wake up anymore.
Marius, if I had a gene, is this methylation, Doc? Methylation test.
methylation
Can I bring it to you,
homocysteine.
Doc?
Of course. Sure, let's talk about it.
No, so what is a gene methylation for those of
methylation
you?
and homocysteine is a set of genes specifically for how your mind handles you and how you handle stress. That's the reason why others are just okay even if like there's a fire or there's a big problem already. And some chismis pa lang tumatakbo na at natataranta and they're depressed. I mean, you know, or crying out loud already just because they heard something versus somebody who's still calm. That could be seen with methylation and homocysteine.
Ayan. So also would the NMN or NAD help me reverse my body aging?
Okay, it's a different thing, but yeah, a lot use that for anti-aging already as a supplement. But one, ensure that you do have the proper dosing and ensure that you got your supplies from a reputable source because I mean nowadays there's a whole lot of fake stuff.
Oh my gosh!
over the internet.
It is
Oh my
scary.
God. It is scary. So just ensure that your supplier is legit. Just so as you get the right thing. I mean, if you're gonna pay for it anyway, pay for something that's good.
Doc Rylan Flores is with us here on Healthline. Doc, why orthopedic surgery?
Okay.
I just wonder, like,
You know what?
was there like a moment in your life
Yes.
like I want to fix broken bones? Like,
Yes. Because literally, even in med school days, I hated orthopedic surgery. Hated.
Okay.
Not just didn't like. I hated it. You know why? It's 2 weeks of rotation specifically for orthopedic surgery, and I only did two things. It's either I clean feet or I cut them off.
Okay.
For 2 weeks.
That doesn't sound like
That's the only things. Those were the only things I do. And during that time, I really wanted to become a plastic and cosmetic reconstructive surgeon for the
where the
beauty
money is.
Exactly. But so because of that, that's what I was leading at. I even trained for a while for that. But when I did my internship, not even my residency yet, my internship, I was under then, he used to be the big boss of orthopedics, Dr. Jose Pujalte. He was the chairman at that time. And he was the guy who simply literally pulled me out of everything just because he wanted me to assist him. So by then, my very, very first case, although my very first case wasn't with him, it was the third case. But my very first case on internship, May 1, I was on duty right there and then. Okay, you're assigned to surgery, go to the operating room. I enter the operating room.
What were you operating on?
For a total joint replacement.
Oh.
And I see this dude in a hazmat with a power saw on one hand and a power drill on the other. I go, oh my God, this is what I want to do.
Really? Oh no. Oh wow.
Carpentry 101. And from then on, I found out that orthopedics wasn't just about cleaning feet and cutting feet because of a diabetic problem or all of these things. So I found out that there are a lot of things that we can do, from joints, from trauma to sports to a whole lot of other things that we actually do, including the spine.
Okay, Doc. Rheuma, is it the same as arthritis?
Yes and no.
Okay.
I'm sorry. I love saying yes and no. Because yes, rheuma is arthritis. It's actually coined from the term rheumatoid arthritis. That's why it's rheuma.
Okay.
Rheumatoid arthritis is only one of 100 or probably even 1,000 reasons for you to get arthritis. So it's more of arthritis comes from the Latin word arthro and itis. Arthro meaning joint, itis meaning inflamed joint.
Okay.
So that's your basic problem. That's what rheuma is all about. Question is, what causes that inflammatory reaction?
There you go. May inflammation na naman.
Yes, inflammation na naman. But 65-70% of the time, it's not aging, but how we age plays a very big role because it's how you move and how you've been moving.
I like okay, speaking of movement, Doc, how important is it that we move as human beings? Kasi yung mga matatanda, di ba, Doc, sabihin lang, hindi ko na kaya, matanda na ako. Di ba, the lesser movement?
I will agree because the lesser movement, your bodies tend to be weaker, they tend to atrophy. And the problem is your memory doesn't do that. I mean, it's still sometimes maintained at a certain level. So you do have that memory of activities and things that you can do. And the problem is, hindi sa kaya, kinakaya mo. That's why you have now problems. So we're not saying that we want our senior citizens to play basketball or do football and volleyball. But the least is to maintain...
Mga extreme sports, di ba?
Extreme sports. But simply to maintain a specific setting and strength that they can need for daily activities they're supposed to be doing.
Oh my gosh, I wish I had caught that on record so I can
will.
send
Don't
my
worry.
mom. No, there's playback, by the way. 6:37 on the show. Doc Rylan Flores is with us. 863-1089 if you have any questions, or you can send them via playback. Right now, I gotta play a new track from Lord, and then we'll take a short break, and then back with more of Dr. Rylan.
Magic 89.9.
Welcome back to Healthline. We were talking about Doc Rylan Flores' what? You have a daughter who's taking up her master's?
We'll start taking up her master's.
My goodness. Okay, yeah, I didn't even think you were that old, though, but...
Well, I'm not that old.
You started young.
I started really young.
For those of you just tuned in, this is Healthline, your weekly dose of anything to do with your wellness, whatever you want to know. We have an orthopedic surgeon who also happens to be a DNA profiler. Back to Marius's question. Can you just clear this, Doc? Na ibang ibang DNA to.
Yes, go.
Because Marius on playback says, I would like to have a gene test for my wife because their family lineage both have, is it cancer histories?
Oh,
or
I think so.
it
Yes.
CA, right?
Yes, CA is cancer.
Yeah. So would this help us determine what to prevent later on? Please
Here's
clear
the
that
thing.
up.
There are tests that look specifically for cancer genes. We mentioned a while ago, BRCA1, BRCA2, they are specific for breast cancers. But we don't look into that because that's already a tier. Principle is these genes have to be stimulated for them to, become cancers.
Buti pa yung genes na stimulate.
So what we do is I take a step back. I look at genes pertaining to health and wellness. That's why if you notice what I mentioned a while ago, none of them were specific for cancer. They're like for inflammation, cell detoxification, methylation and homocysteine, cardiovascular, vitamin D3, and even your fat absorption. These are the things that you do on a daily basis to live. So it's just how do you do that? Because presuming that you're relatively well, your genes won't stimulate these cancer cells or these cancer genes.
Okay.
So that's the idea of it. That's why I don't look into it. As a matter of fact, recommendations, I don't even give medications. It's more of lifestyle, your diet, your activities, and what not to do. And if necessary, yes, supplementation, but I'm not even in that level where I need to give you medication.
Wow.
So it's all in the canvas of your painting of what you do on a daily basis.
Wow. Oh, okay. Very interesting, Doc. I mean, you guys should see my facial reaction on playback.tv/magic899. I'm just in awe. I'm like a student learning. Doc, so many people are stuck in traffic, and we lose so much time. What can you recommend to our listeners stuck in traffic? Simple, simple daily habits that can protect our bones while sitting.
Simple daily habit. Listen to Magic 89.9.
Thank you, Doc. Thank you.
No, but seriously, all of us, none excluded, especially for the working class, we really get stuck in traffic, whether you drive, whether you're the passenger, or even just a pedestrian trying to cross the street. So first things first is that, let's just keep our cool and enjoy. That's the reason why literally listen to us. Listen to Magic 89.9.
Talagang stress
But-
really is the killer, no?
Because
Dong?
yes,
Yeah.
unfortunately, even before we look into other things, stress is a big factor. Now, technically, it's not stress because all of us have stress.
Yeah.
It's how you
We
perceive
handle?
and look into that stress and how you react from that stressor.
Okay.
So it's as simple as each one of us. We all have problems. They might be the same, they might be different, but how come we still get to smile even if you have probably pains in the moment, back pains or whatever? I'm still panting from traffic a while ago coming here, so I won't be late. But there are some, like financial problems, really sick, or all of these other things, and yet you see them with a smile on their face. But I mean, I was just like with this lady over the weekend in one of my clinics, and she was really so haggard, down, and feeling depressed. And I go, "How are you? What are you feeling? Is there any pain or anything?" Doc, it's not that. So what seems to be the problem? It's a Saturday. I don't know where to bring my boyfriend tonight. See that?
Okay, that's
So,
her stress.
That's her stress. So it really doesn't matter what type of stress you have. It's more of how you perceive it to be and how you react to it. So you listen to good music, you listen to good conversations like we're having right now with Tina.
Legal drug expert 26 on playback. Doc says just arrived at work here at POC. Good to hear an OS from Healthline. Thank you. Thank you.
Great.
Let's talk about you being a governor of the Philippine Medical Association.
Okay.
Where do you even find the time, Doc, between your clinics and now you're the governor? And
Well, okay. Let's put it this way. It's not a political thing. It's a medical thing.
it's a medical thing. Philippine Medical Association.
Yeah.
Okay, guys.
And technically, I started my term over the weekend, June 1. So
Oh my goodness,
really new.
congratulations.
I don't know if it's congratulations or the opposite. Oh, my bosses might be listening right now. No, but the Philippine Medical Association is the organization for all of us doctors. So currently we're around 104,000 plus.
Whoa.
That's all over the country.
Okay.
And we're divided into 121 component societies from the tip of Luzon all the way down to the tip.
I'm sorry,
of Mindanao.
120.
121.
Whoa, okay.
Now, these 121 component societies are divided into several regions, just so as you can get to, information to all these doctors and vice versa. So they're divided into regions. One region may have as small as probably 6 or 7 components within the region to something as high as 14, like the stamp region has 14 component societies. That's in the Batangas area and the southern Luzon area.
Okay.
But there are 2 that simply has only one component society. That's Manila. That's why Manila is a region on its own, simply because Manila has 6,500 members.
Okay. So
And-
we have the most members.
No, Quezon City has.
Oh.
It's Quezon City.
Okay.
It's the largest component society. As a matter of fact, we actually have, all in all, more than 13,000 members. So that's how many doctors you have here in Quezon City.
Wow. Okay.
But of course, the active ones would probably be around 9,000 or a little less than that. So because of the amount of members, that's why the component society is just one in that region. But Quezon City Medical Society is divided into 6 districts, following the 6 congressional districts of the city. Because long ago, a few years ago,
Pero rotary pa.
yes.
Very similar.
Yes, I mean you have that principle of the administration and everything is down. It's quite similar. So you have different members, and the membership has to be either where you live or your practice. That's the reason why there are also a lot of members in Quezon City that actually don't live in Quezon City because they have their trainings
Somewhere
in
else,
hospitals that are in Quezon City. I mean, the big hospitals are in Quezon City. So when they do their training there, they become members of the Quezon City Medical Society, and then afterwards they go back to their provinces, and they don't move their memberships anymore. That's why they're still part of the Kansas City Medical Society. Now, with the PMA, so I was president of the Kansas City Medical Society at one point in time. So I'm now the governor, which means I overlook and become the liaison of the Mother Society and the Component Society.
Okay.
So whatever one needs from the other, I'm kind of the conduit for it. So it's more like you consider like congressmen, senators, and the national office.
Yeah.
So the component presidents are like your congressmen, or each and every one in every district. And then you have the national, where you have the president and everyone else. And the board of governors technically is like your senate, wherein you represent areas, but you don't only look after your area. You now decide for the entire country when you do your board meetings.
Whoa.
So that's kind of a something. And it
looks like you have a lot on your plate this year.
A whole lot. And it ends up literally going around the country, visiting these different regions and looking into the grassroots of what their condition is, so that we can, recommend better rules, better regulations, talk to the necessary people.
Awesome.
By the way, congratulations to Secretary Ted Herbosa, because, the president is simply
Is he our
refused his courtesy resignation for DOH.
Oh, nice.
So,
may balita ka sa FDA.
Last kasi...
Is it still
We'll
talk about it off air.
That I don't know, because wala pa si list. That I don't know. But Secretary Ted lang, kasi it was like just like earlier this morning.
Oh my gosh, I'd love to have the Secretary of Health
invite
here. Yeah, let's
Sec
invite him.
You listening?
Oh, Sec Ted. Darapay naman po.
po.
Doc, I know you have a bunch of people to say hi to. Oh my, the hour just went by like that.
know.
Please say hi to your friends, because they're messaging you.
I see Direct Jojo is there.
No, Direct Jojo's tuned in. Hi, Direct.
Bong as well is listening in the car at this point in time. But heck, wait, with the few seconds I have, I'd want to invite my colleagues who graduated from the De Los Santos Medical Center residency program.
They treated us really well in De Los Santos.
Thank you. Whether you're you're an internist, a pediatrician, OB-GYN, a surgeon, an orthopedic surgeon, even the dental oral surgery that we have, we're inviting all of you. There's a very first homecoming tomorrow night in line with the anniversary of MPIC and the De Los Santos Medical Center. So tomorrow night at the hospital, at the 8th floor, the Presidential Lounge. I hope to see all of you there, and let's just look into where we came from and where we're headed to.
Oh, I like that. Sounds like a lot of fun.
It's gonna be a lot of fun.
Doc, and I know you do Facebook Live as well. Doc
Yes.
Ryland here also has 2 shows on the radio. He also writes for Abante,
Yes.
right? And it's your anniversary today. Is it today? Oh.
I started writing for Abante tonight, June 4, 2019.
Look at you.
And I started for Abante the month after. So I do write for these 2 tabloids, and we're called Tabloidistas. And it's called Clinic Hour and Magtanong Kay Doc. These are the 2 columns I write there. And I do have radio programs every Tuesday morning at 10:30 over at another station.
You can mention it if we don't mind.
It's AM anyway, so
Yeah.
it's DZEC 1062 Radio Aguila. And every third Sunday at 9 a.m. Health Watch, also at DZEC 1062 Radio Aguila. But Facebook Live, Doc Ryland, is always on Sundays, more or less around 11 o'clock. I just hope I'm on time.
AM naman to.
Yeah. So Facebook Live, Doc Ryland lang po.
Doc, thank you so much for stopping
Thank you.
by. And
Thank you.
Okay, this is another invite. Please come back.
Definitely.
We didn't even go through the 20 questions I sent you.
I told you, we're just going to be in questions 1 and 2, and that's going to be the hour.
It's been so much fun, Doc, and
Definitely.
I want to see you very, very soon. And that ends the first hour of Healthline. I got to take a quick break and
Magic 89.9.
9.9. Welcome back to Healthline here on Magic 89.9. Let's talk hormones.
Oh, yeah.
I think I'm over, yeah. The body's messengers. Joining us now is endocrinologist Dr. Patrick Paulo Abarquez, expert in thyroid disorders, diabetes, and more. Doc, glad to have you. And
Good evening.
The 2 doctors actually met. I highly encourage that, because it's super traffic outside, Doc Patrick.
Yeah,
oh
definitely we saw the traffic.
Sabi nga ni Enrix, down ramp to Bikutan is so bad.
Oh, wow.
And somebody, ano ba pinapakinggan ko the other day? Parang we're losing billions. Parang
Yes.
monthly because of traffic. So,
Traffic has been there since like I was born, so it just gets worse every year.
right?
Yeah.
So, how do you both feel about the postponement? Biglang pinag-usapan na kayo na yun.
Oh, definitely it's a relief.
And 7:14 on the Magic. I'm Tina Ryan. If this is Healthline Wednesdays, we talk about whatever is bothering you in your health. So if you have any questions, please send them our way. Playback.tv/magic899 or 863-10899. I was just about to tell a story off air, but I'm like, I'm gonna save it for on air na lang. No, because I'm a suke. Doc Patrick is from VRP.
Yes.
So before we introduce him like properly. So one time I was here doing Friday Madness and I had severe, like, yung parang mamamatay na pain type of, situation. But
Okay.
I have a very high tolerance because I have 2 ectopic pregnancies already, and I thought it was just like a regular period. I went camping pa in Yosemite. Doc.
Oh my God.
Nag-camping pa ako, Doc. Yung pala ruptured tube na, no? Mamamatay na pala ako. So anyway, I thought it was, oh my God, what is it again? Nagawa ko pang lumakad sa VRP. Tumawid pa ako sa overpass.
At least you had the strength to do
but
that.
like the guard at the emergency room talagang alam mo yun, hindi niya alam yung gagawin kasi nakagano na ako. But I was still walking. I was just
You were lucky enough to
On
reach the ER.
But anyway, okay, for those of you for those of us like ako, I don't know what an endo is, Doc. Endocrinology. Endocrinologist, what exactly do you deal with?
Okay, we usually deal with a lot of hormones. I mean, hormones are usually things you don't see. I mean, unlike the heart or the kidney, you see them, or the lungs, you see the X-ray and then you see the lungs. But for us, it's just chemicals around the body. So we deal with a lot of the chemicals around the body.
So legit yun, Doc, pag sinabi ko, hormonal ako, kaya ako
Oh yeah,
masungit.
it's legit. Yeah.
Oh, okay.
It affects the mood. It affects everything. I mean, most of the functions of the body.
Wow.
Yeah.
Okay.
So you're there.
I asked Doc Ryland the same question. Why? Kasi siya, may story siya about why he chose orthopedic surgery.
Oh.
Why did you choose endo naman?
Well, it's not because of the topic, really. It's more of the work-life balance, I think. Because you get the clinics in the morning, and then in the evening you can do something else, like be on a radio. Definitely. So I think most of the internal medicine specialties, we usually have a work-life balance in endocrinology. Yeah, definitely. Unlike the surgeons here, who have to be there in the surgery, early in the morning.
Okay.
No, I don't wake up early in the morning. I can't.
Doc Ryland, your microphone's on. What are the most common endocrine?
Endocrine.
Endocrine, I don't even know how to pronounce it. Endocrine disorders that Filipinos face today.
Okay, one of the most common ones will be diabetes. So it's
Oh, crap.
usually sugar going haywire, insulin going down, or it's not working. So there you have diabetes. Also, there's obesity. A lot of us people already have very bad waistlines. So our diets are not so good. So the Filipino diet is not good. So
But I think compared to the US naman, Doc, we're doing much better,
yes,
diba?
definitely.
Oo, even the
Definitely.
obesity in children,
Yeah,
diba?
in children. Yeah, it's
Oo.
very prevalent, especially in 12-year-olds, teenagers. Yeah.
And you're here, but I have 2 doctors who will back me up. We do have a tendency, tayong mga Filipino, di ba? Like
Yes.
parents, na parang, kasi cute yung baby.
Cute yung matabang.
Yeah,
Mataba.
cute yung matabang
And then
baby.
the
And
cheeks
then,
go
yeah.
like that.
Oh,
Yeah.
oh.
Unfortunately, it's not a good sign, literally.
So,
Yeah, definitely.
please, Doc Pat, tell them why that we shouldn't be encouraging that.
Yeah, because, it's linked to a lot of cardiac diseases, hypertension, cholesterol problems, heart attack, stroke. So we have to watch our weight. We have to watch our diet. The Filipino diet is filled with lots of oils, fats, lechon, and everything. So we fry everything, we smoke everything, we grill everything. So it really gets to our stomachs and, it goes to our arteries and, boom, heart attack and stroke. Yeah.
Now, diabetes seems to be on the rise. Like, oh my God, the HIV cases among. Okay, let's not even talk about that.
We can talk about it.
Oh my gosh, that's why we need the Doc
But,
Ted from DOH.
But not only that, we'll give you some ideas on that. But I'll leave him on first about diabetes before we discuss HIV.
Can you explain the difference? Please tell me, because my dad's diabetic.
Okay.
Between type 1 and type 2, Doc.
Okay, so type 1 is the absence of insulin. So probably there's like some autoimmune problem that attacks your pancreas, which produces the insulin. So it's diabetes type 1. So definitely...
This is the manageable one.
Yeah.
Okay.
Both naman. I mean, both are manageable. To type 1, you definitely have to give insulin. Type 2...
Oh, yun. Okay. Type 2 is...
Type 2... You have insulin, but it doesn't work very well. So you have oral medications, you have insulin, you have metformin, and all the other oral drugs that you have. That's type 2. And that's what's more common nowadays.
Oh, okay.
Yeah.
So...
Well, actually, if you look at it, not just diabetes, but we were talking about obesity a while ago. It's you also need to look into the opposite of it. When these teenagers grow up, and people would say, ano lang yan, diet and exercise. But the problem is, there are a whole lot of things more than just diet and exercise, which we do ask and refer to endocrinologists because of hormones. and everything else.
Yeah, there are many.
They actually play a very big role.
Yeah.
Oh, so how big of a factor do hormones play when it comes to, I guess, diabetes?
Both for obesity.
Diabetes.
Yeah,
diabetes and
both.
all.
Because you have to find the underlying causes, because there are other diseases that cause diabetes and obesity. So
Yeah.
there are other hormones that work in play. It's not just insulin. It's not just the diet or exercise. It's more than just that. So you have to test and see the patient, especially when you refer the kids to us.
But I feel so smart tonight, guys.
But not only that, there was a study that was made for the patient to realize that they need help because they're either overweight or obese. Takes them a couple of years before they accept that. The problem is, before they seek medical consult, it takes at least 6 years. So within that time frame, you can have a whole lot of complications arising because of that. That's the reason why we tend to shorter the gap.
Yeah.
Meaning, as much as possible, because even for doctors, it's sometimes delicate matter talking about weight. So even the doctors hesitate to ask patients like, do you need help about your weight and about being obese? So these are sometimes the problems that we want to look into, so that the gap between when the patient realizes they need help and when the doctor would actually step in and help shortens. Instead of 6 years, shortens a whole lot of time from that.
But I know you can both agree with me. We've been in the past maybe 10, 15 years, meron na tayong wellness revolution, diba? In the country.
A lot.
So I feel like
We're
we may
actually, doing more exercise, and there are a lot of diets around. I mean, everyone's running even here in.
Have you guys been to Makati on a Sunday
everyone's
morning?
running, right?
Everyone's running.
It makes me want to run in the
Not only that, you just go behind the studio around the area of Greenfield.
Yeah.
At this
Definitely there will
time,
be people
everybody's
running
running.
there.
Yeah.
At this time, everybody's running.
Why do you think so?
I think they're more conscious enough. Maybe social media or whatever.
played a
maybe,
big factor.
Yeah, I think so. Yeah, definitely.
Which is a good thing for everybody.
It is. That's a very good thing. And not only that, they're much aware right now of what conditions can arise because you're not healthy. So that's when you look into your diet. That's when you stop vaping, not just smoking, but vaping. And then you look into other things within you and have your annual physical examination, and not just because they take blood and that's about it.
Yeah.
But look into the results and see what's wrong with you so that you can prevent anything from making it much worse from what they are right now.
Doc Patrick, is it true that even skinny girls or skinny people can get diabetes?
Oh, definitely, because as I told you, for type 1, you have your pancreas being attacked. So
Okay.
it doesn't have to be that you're fat, or it doesn't have to be your
Like weight
whatever.
doesn't have anything to do with it.
Yeah,
Okay.
it doesn't have anything to do with it. So you can have diabetes with that.
Wow. I don't, yeah. Wala pa naman ako kilala na payat na may diabetes.
Oh yeah.
Oh, wala pa naman
Well,
in
I
my
have
circle.
patients.
In my
Kilala
circle of
kita,
friends.
gusto mo?
Most of them are just fat or obese probably.
Now, as we age, how do our hormones, hormone levels change, and what effects, Doc Pat, can this have on our health?
Oh, definitely. There'll be aging hormones. I mean, usually in menopause and females.
Wait, when you say aging at what?
That's what you asked.
Wait, does it start at 40?
Well, it starts around 50, 60,
Oh my
depends.
Okay, no, because I think my gynae told me that I'm candidate for premenopause.
Okay.
Because I don't have kids nga daw.
Yeah.
And so I'm like, oh, I don't even know what to expect. Like,
Yeah.
And then my mom's making fun of me. She's like, oh, no, anak. You would know what hot flash is when you actually feel it now.
Yeah, you'll have hot flashes and everything.
But the thing is, you know what? If there's something that's regular about women and their menstruation, it's irregularity of it. Meaning, even if you reach menopause, most would give you all of these hot flashes or headaches
Mood
or whatever.
problems,
But
nausea.
I know of some that have zero symptoms whatsoever. They're so lucky.
Why do you think that? Do you think
it's person to person? Maybe they don't feel whatever hormones they have.
It's the individuality of a person. Remember, we're talking about genes a while ago.
Yeah,
It's the
okay.
individuality of a
everyone
person.
that gets it.
But do you think if I took better care of myself in my, my early 20s, medyo ano na ako, alam mo yung fitness.
Well, definitely it
Ganon.
will help.
No. I will agree. Wait. I will agree. I did not disagree. But what I'm saying is you're talking about what if. Point being is that's the past right now. So the idea is to do something right now
Yeah.
and look at your body and work on it. And hopefully any complication, whatever the disease entity might be, would just simply decrease.
Okay.
I would agree with that. Just to say, just work on what's today.
I like that.
What's the present? We can't,
Exactly.
change your past.
I like that. I do have another question, but I have to make way for a really good song because we are the home of today's best music, right, guys?
Oh, yeah.
If you're stuck in traffic, I hope you're enjoying the conversation we have between two amazing doctors here on Healthline. Right now, let's make way for a little. My song just disappeared on me. Give me 1 second. It really did. Oh, here we go. Here we go.
Magic 89.9.
Breeze on Magic 89.9. This is Healthline. For those of you just tuned in, I've got two amazing doctors with me. Doc, si Enrix, ano na to, hormonal na. Isang oras na daw di gumagalaw sa likod.
I think it's not just hormones anymore.
Enrix, don't worry. We got you. We're with you right now on air.
Just listen to us. It'll be good.
Diba? Enrix, I feel so bad, but you know what? That it is what it is. I mean, I think we just have too many cars. Urban planning,
Yeah.
diba? Parang, I guess. Yeah. Walang naging planning
Even
dun sa
there's the
urban.
skyway and everything.
Diba? I mean, my gosh, even yung Skyway,
It's still
traffic on a
yeah.
Friday. Diba?
Well, the Friday, because everyone's either going home or going out by then.
Yeah, everyone's like
I would
outside.
presume tomorrow's traffic would be a little worse because it's a holiday on
what's-
Friday.
Oh, it's
It's a holiday on Friday.
the ano
Eid
ba?
al-Adha.
Yes, thank
Yes.
you. Thank
So
you.
you could just imagine tomorrow night's traffic.
Good luck.
Oh, because everyone's going out of town. Are you working? You have
Yeah, I'm
rounds?
working.
Oh, somebody's on vacation.
No, I'm
Good
not.
for you.
I'm
Me at work.
I'm not on vacation because I'll be giving talks. It's a pre-Independence Day, but it's just not going to be here in the country.
Oh, well. well.
Okay.
Oh, is that the one in Korea?
Oh, no. That's next week. This one's in a different country.
Oh wow.
Fine.
Sana all.
Okay. Doc, going back to ito mainit-init na question. Please ask Doc why thyroid probs are on the rise, especially for women. And Ano ba yung hyperthyroidism exactly? And like, talk to me, Doc Pat, like I'm a 7-year-old.
Okay, hyperthyroidism is usually, a combination of symptoms, palpitations, tremors, and, all the fast metabolism and everything, eyes and everything. So, when females get it, mostly females get it around 8:1 ratio.
What?
8 females,
What?
1 male.
Wow.
So most of the hormones are usually haywire, especially with the thyroid, because females have estrogen, progesterone, and all the other hormones. That's why you're more likely to have hyperthyroidism, unlike men probably. So
Oo, kaya ako DJ, hindi ako
Yeah.
nag-medicine.
well, hopefully I could explain that to a 7-year-old. I'm not really sure if a 7-year-old might understand.
I was gonna get into that.
But some 7-year-olds do.
Hold on. There's another thyroid question coming in. How does the thyroid affect our daily energy levels and metabolism?
Okay, it's like our battery, no? So
Ayan na naman ang battery,
So
pinag-usapan
when you're
din
like
namin.
in a car, you have your battery, it makes you function. Like it starts up your engine. So it starts your heart, it starts your gut, it makes you digest things, it starts your lungs, it makes you breathe, it starts your brain. So probably if you're hyperthyroidism, all of these go fast. So fast heart, fast brain, fast lungs, fast gut, everything. And if it's hypo, everything's slow naman. Yun.
So it's either if you're on the brink of being hyper, everything's so fast, or when you're hypo, everything's so slow. We just hope and pray that you're in euthyroid in the middle where
Yes.
everything else is normal.
When all is in balance, like a car. Diba? You're like on the 60 kph lang.
Have you had a patient go up to you thinking they have freaking heart attack? Yung pala hyperthyroid.
Yeah. A lot of them come to us. Yeah, they have chest pain, they have palpitations, they have difficulty breathing.
Okay, so don't panic.
And then you just test the thyroid. Okay, it's just thyroid. You just give medications, then you're good.
Oh my gosh. Okay. Well, what about kasi nga, Doc, ang problema ko, I really have high tolerance for pain. I wouldn't even know if something's wrong already. Come on. I almost died
yeah.
twice, diba?
Yeah.
So parang,
Hearing you about it, yes.
Parang at what point should I worry when it's like something is super painful na?
Well,
Wait,
Diba?
hold on.
there's not much pain in hyperthyroidism, but
Okay, but
you can have chest pain. So I mean, abdominal pain,
Okay.
back
Not so
pain,
much,
joint
right?
pain, not so much in
But
hyperthyroidism.
with the palpitations, usually you end up with feeling mo in love ka pero hindi.
Yeah, feeling mo you're on a high. But actually
I love
you're
the
not on a
analogy.
high.
I love-
Yeah.
So,
the analogy.
but for people like what you experience, I mean, it takes a while for you to notice that there's, especially for pain, if you have a high tolerance for pain,
Yeah.
it might take a while for you to notice that there's something wrong.
Yeah.
So instead of looking out for pain, just look out how uncomfortable you are.
Okay.
If you become a little uncomfortable, a little irritable, there might be something wrong. You just sit back and rest. If it's
Hormonal lang.
comfortable,
Yeah.
if it's comfortable,
If it's
As a
comfy,
fan to say,
probably
we're
it's
good.
just something that's going away.
but
Yeah.
if it's not and it doesn't seem to go away in a day or two, heck, go and see
Go
your doctor.
see any doctor.
Okay, but I went camping.
You went to the doctor at that time?
Oh, I think that's a different story.
Christian says hi and good evening, Doc Rylan and Doc Patrick.
Hi.
Thank you,
Hello,
Christian, for
good
your
evening.
support. And also to Junski. Doc, ito naman, let's talk about the hormonal imbalance in youth. Kasi parang lately, we've heard more teens are dealing with hormonal imbalances. What could be causing this?
Well, one could be diet, of course. Fast food. Everyone's on their phones. They're like sleeping or they're sedentary. Precisely, everyone's not moving. So, unlike before,
Movement,
diba?
Doc
Just
Doc
imagine.
Rylan.
I mean, just imagine if you don't have any, because you're so young, you don't have any idea what the older ones are. Try just to take like pictures of or paintings or all of the other things way back, probably in the 60s, the 70s, the 80s. you notice mostly would be activities,
Yeah.
games.
Yeah, they're
They
on
play,
the
they
road, they're
run.
playing.
Exactly.
Yeah,
In
we
contrast,
had the
all the
kalsada as our playground.
all the
But
childhood.
right now, you notice most are like just stuck up in their corner.
Yeah,
That's
they're on
why.
their computer.
That's why they don't move much.
Tablets.
Tablets,
Then
yes.
what happens if you're seated? You tend to eat a lot.
Yeah, you get
Question is,
fat.
what are you eating?
Ayun.
What's
Oh
the
my
best? What's the
gosh.
easiest thing to eat? Your junk food, because you know, just
Popcorn.
quick minute.
Food, yeah.
Popcorn chips. Oo.
Okay pa nga si popcorn eh. Pero the chips and the soda and all of these other
Sweets,
things.
chocolate.
So that's where the problem lies on.
Yeah.
So we really have to educate parents then, diba? Kasi a big part of, I mean,
Unfortunately, you also have to take a look and take into consideration that and sometimes these parents, because of the difficulty they went through during their childhood, they wouldn't want their kids to experience that. So now
I
they
get
kind of
it. I know the
reverse it.
feeling.
They baby their kids too much because they don't want for them to
Them
experience the
to-
trouble,
the
the hard work, and all of these
deprivation,
things. But then the problem starts actually. So
You give
two
everything
ways.
too
I mean,
much.
you really have to talk not just to the kids,
But also the
the
parents. Yeah.
okay, let's talk about stress and poor sleeping patterns. Can this really affect our hormones?
Oh yes, especially a lot of us are on night shift, so most of our cortisol should be down at night, no? So for people in the night shift, definitely they'll have their cortisol high, so they'll develop diabetes,
Yeah.
cholesterol problems, obesity.
Pero di ba, Doc,
Yes.
may certain, tama ba yun? May certain time na our organs function properly. Tama ba
Yeah,
yun?
it should be something like that.
Parang-
It's usually high in the morning and then it dips down in the evening.
So paano yun?
you
Kung
have
night
to have.
shift,
It's called the circadian rhythm,
Yes.
which
Okay.
means that because we live here, we stay here, we have the mornings as mornings, we have the evenings as evenings. Unfortunately, in the advent of all of these other jobs, especially for BPOs,
Yeah.
where they deal with offices with countries with a different time zone.
Yeah.
So your mornings are no longer mornings, your evenings are no longer evenings.
Yeah, so does that mean I'm like
At risk.
At risk.
Yeah.
At risk.
Oh,
Yeah,
We're
You're
not
at-
gonna say we're not gonna say that automatically you're gonna get sick. But that depends on how you
take-
actually acclimate yourself with that condition. I mean, babaliktarin mo lang para kang palaging araw-araw
you're
may jet
trying
lag.
to make your evening
So
morning.
your evenings are mornings, your mornings are
Mornings are
evenings, which
evenings.
means that the problem that we usually see is that most of these, especially the BPO agents, they're on evening shifts because say it's the American time zone, the European time zone. So they work evening hours and supposed to be resting in the morning. Unfortunately,
don't.
they don't because they
Yes,
do
they go-
errands.
They drink.
They drink.
go
That's
to
not
gym.
true.
Oh my gosh.
But that's the time when you're supposed to be sleeping and resting because it's the morning. That's the time they go. Yeah, you said it. They go to the gym. That's the time they do their errands. They do all of the other things, do grocery, etc., etc. You're supposed to be sleeping and
You're
resting.
supposed to
So that's why now they're
replicate the
overworked.
evening.
Yun, I like that. Replicate the evening. I like that. Okay. When should someone consider seeing an endocrinologist instead of a general doctor?
Well, most of the diseases that we treat are usually capable naman yung mga general physicians, no? But usually when they can't do it anymore, usually they refer it to us. When you have insulin, when you have injectable medications, when you're up for surgery or
I was going to say, we don't manage anymore. Surgeons don't. We just simply pass them on to endocrinologists. I wouldn't want to
they
have a
pass it
headache
everything to
already by
us.
then.
Yeah. I know. Yeah.
No, but means generalists actually see all of the other disease entities and they're capable of giving the necessary
Yeah,
medications,
definitely they can.
necessary treatment. But at one point in time, the question is, are they doing good or not? So if they're doing good, that's okay.
Well, then
But
good,
if they're not, that's the time you actually tend to refer to specialists because you might be missing out some. That's the reason why they're specialists.
Yeah. What about hormone replacement therapy? HRT? Tama ba?
Yes, yes,
Hormone.
yes.
What's the backstory of it? Does that
Usually
really
we
help?
give it to women to alleviate all the symptoms of hot flashes, mood
This is where we
swings.
tag team.
This is where I call
This
you
is
in
where we
2
tag
months.
team.
Yeah.
All Oh, just 2 months?
Wait, how do you administer? Ano ba yan? Pill? Or
There
is
are
it-
pills,
Okay.
there are
Injectables
injectables,
and everything.
there's
Oh.
topical, you put a gel.
topical.
Yeah.
Okay.
Remember that he was mentioning about estrogen, progesterone. These are the hormones that actually happen, rise and fall during your menstrual cycle.
Okay.
Menopause is basically when this ceases, which means you don't have
Wala na.
menstrual
All
anymore.
down na.
You're officially declared menopause once it's a year since your last
Period.
menstruation. or
Okay,
period.
okay.
So, question is, when that time comes, that's why you were saying about peri or premenopausal.
Yeah.
You now have all the signs and symptoms because it's kind of faltering
having it
already.
going down.
So, endocrinologists will give you the HRT.
Yeah,
Your
HRT.
obstetricians give you
Yeah, they
HRT.
also do.
I'm sorry, what?
OB.
The OB.
OB, okay.
Yeah.
But the question now is for us. That's why we play a partnership with endocrinologists and obstetricians. Is because we look into your bone density or what's the quality of your bone.
Good your bones are.
Because estrogen plays a very big role in absorption of calcium in bones. So if it stops, then absorption isn't that good anymore. So that's the reason why when you reach the menopausal stage, that graph of bone quality doesn't just go down with age. It actually
He's
drops.
trying to tell me in the nicest way.
That you have to make your bones
But it
stronger.
drops. So
Okay.
the question is, when it drops, how far is it gonna drop from, and how far is it gonna fall?
So is that measurable?
That's why.
Yeah,
yes,
that is.
we do
Yes,
bone
yeah.
densitometries, usually either central or
It sounds
peripheral.
painful. I mean,
It's just like an X-ray.
No, it's like
Okay.
You just lie
it's
down.
multiple X-rays.
And then
Okay.
it just passes through. There's only a couple of requirements. We don't let you drink any calcium supplement for like 2 days because you don't literally melt that capsule. It's like you pass it out. So it takes 2 days for that.
I was gonna ask both of you actually. Do you believe in calcium supplements?
Definitely.
Okay.
Of course.
Yes. But the question is not just calcium supplements. I go back because we need to look into how much calcium are you really taking in a day via your milk intake, your food, your vegetables, your fish, your protein, all of these things. Because if you're taking something sufficient, you
Then
don't even
the
need calcium supplements.
Yes.
But if you can't, like most of us,
Most of us don't,
then
have
that's
a
the
good
time
diet,
you do
so
need
then you
calcium
can take it.
supplementation.
Okay.
But it doesn't stop there. You have to have vitamin D3 to ensure metabolism of that
To go
calcium.
out in
And
the sun.
you have to have vitamin K2 to ensure that calcium you've absorbed goes directly to bone.
Oh my gosh, this
A lot of things to think about.
information overload. Hi,
I
Tex
feel your head's gonna be
Smith.
exploding.
Nagdo-nosebleed na ako dito. Internally. Hi, Tex Smith. Thank you so much for listening. What are there any myths, Doc Pat, about hormone health that you would like to clear up?
Well, there are so many fad diets, fad medicines.
Okay, what's the latest fad diet?
Oh my God.
Yung
Keto
talagang
diet.
like thumbs down ka.
Keto diet.
Okay, so that's
Intermittent
bad.
fasting. I'm not a fan.
I will. Okay. I will say 90% yes to that and no to some, because remember, that's why I look into your genetic profile, and that's the reason why for some ketogenic
works.
diet is actually really good and it works
Yeah, it
because your
works
fat
naman.
absorption genes are beneficial. But if they're not, then it's going to be so detrimental that you just might end up in the ICU.
Yeah.
So that's the reason
Not
why.
everyone is for it.
Yeah.
Before you hit that fad diet, go consult your doctor.
Yeah.
Go
Make
consult
sure
your
that it's for
endocrinologist.
you.
Oh.
Yung intermittent fasting naman, I mean, yeah, they don't eat at 2 p.m. or whatever, pero they eat a lot, too much at
So,
2 p.m.
Kasi yung
Yes.
feasting na tinatawag.
Yeah.
Oo.
What I hate is the, how'd you call that? The free day?
Cheat day.
You know why I hate that? Because most would tell you, Doc, it's okay, I'm gonna eat because it's my cheat day today. Teka muna, parang kahapon cheat day mo rin, di ba?
Parang cheat day.
Parang
every
cheat
day.
day every day. Exactly.
Yeah, for sure.
exactly.
Kaya-
Hindi, tapos yung
Yun.
cheat day nila, they're gonna go all out. Like,
All out.
isang
Yeah,
kilong lechon
like
or something.
buffet.
You know,
Yeah.
wait, let's talk about lechon. In defense of lechons. Well, you know, sponsor again. No, but seriously, lechon is basically roasted. It's not fried.
Okay.
So there's a difference. So with fat absorption, anything fried is a no-no, di ba?
Yeah.
But lechon, literally, if you look at the meat of it, especially if it's, if it's cooked well, you have a roasted meat. So
The white
that's
meat
relatively
inside, yeah,
okay.
yeah.
What's not is the actual
Balat.
the masarap.
Oh,
The balat. And in my case, my favorite is the belly.
Yung
I have
kinakain ko yung balat.
I have the belly. You're supposed to try it. Biglang ganun.
Masarap yung belly, but it's,
I even asked, salbahe pa. I even asked the butcher, can you twist it a bit? And I want this portion lang. Right?
Oh
There's-
my gosh, the belly talaga. Okay, yeah. Oh my.
Lots of fat.
No, but seriously, it's how you watch your diet because I do remember having this patient of mine. That's her problem with all of this cholesterol, triglyceride. She's becoming a little bit obese already, and she's Ilocano.
Okay.
You love
So bagnet.
and the sukang. the bagoong.
Yeah.
Okay, here's the thing. The problem is she goes like to her house in the province once a month. So when she goes back to the province, she eats up 3 to 4 kilos of bagnet.
My.
Because you were saying you crave.
Yeah, you
So you
treat-
know what we did when I got a chance to talk to her? So let's do it this way. Salads, get your bagnet, cut around an inch thick, 5-6 pieces. And then have your dressing, a little of your bagoong Ilocano with a little vinegar.
Yeah.
It's a vinaigrette. That's what you mix it with. You
Yeah.
now have the flavor of the food that you love. So
Pero,
by the time you go back to your province, you won't eat as much anymore kasi you're not deprived. So that's the reason why,
Kasi
in reality for me,
crave.
Yeah,
it's
you're craving too much.
anything in
Yeah.
moderation is the best. Because otherwise,
sense.
you crave, and once you crave,
Wala
ay,
na.
kalimutan
All
mo
these
lahat
problems.
yan.
All out.
All out na talaga.
Wow. I mean, time again, the hour went by too
Oh,
quick.
wow.
Doc Pat, for my life, parang Miss Universe lang, diba? What are some daily habits people can adopt to naturally support a healthy endocrine system? I don't even know what an endocrine system is.
Well, definitely you have to move.
You've actually been talking about it.
Ano yung
Move
pinaka-endocrine
a
ko?
lot. You eat
Marami
right.
kasi. Marami kasi.
So, we
You watch out what you eat.
Okay, watch.
You move more, you walk, you do running or whatever exercise.
Just move.
Just
do
move.
something. Oo.
And then take away yourself from all the phones and the,
I will second the motion, and that's not for endocrine, but for bone care. I will second the motion for everything you said.
Oo.
Definitely.
Syempre lahat naman yan related.
Yeah, it's all related. We also take care of bones too.
Doc Pat, if people want to see you, where can they find you?
Okay, they can find me. Okay, thank you. I have a chance to promote my clinic at VRP Medical Center.
I will be
Room
knocking next-
401. Monday, Wednesday, Friday, 10 to 12 noon. And our hotline is 8464-9999. Local
So,
151.
Monday, Wednesday, Friday, 10
10 to 12.
10 to 12.
Yeah.
And then the what's that? The
Hotline.
Hotline is
8464-9999.
yan. Local.
Local 151.
Yeah, local
Yes.
151. Doc Pat.
See, he has that good life balance because 10 to 12 p.m. My clinic's like 3 in the afternoon until heaven knows when.
Oh my gosh, this has been so much fun and just like a lot of information I'm taking home with me, and I feel like I'm in great hands now, knowing I have
definitely.
Diba? I have
Yeah.
Doc Pat now. I have you,
And
Doc Rylan.
we're just like right across.
Oo, tatambling lang ako, nasa VRP na ako.
Right.
Sa'yo, magkukumita ako ng konti.
Konti lang naman. Konti lang, but the traffic might be a little bit terrible.
Okay, and your clinics again, Doc Rylan, where can we find you?
Well, De Los Santos Medical Center. I'm there Monday, Wednesdays, Fridays. As I said, 3 o'clock till heaven knows when. But you can just message me and my page on Facebook, Doc Rylan, RYLAN, and hopefully I can discuss things with you there.
Okay, one thing you want to leave the listeners with, like, you want to go first, Doc Pat?
Well, I think my bosses are here. I have to shout out to certain people of VRP Medical Center.
Hello, everyone at VRP.
Yeah, so shout out to the chairman, Miss Vergel de Dios, hospital administrator, Miss Rona Garcia, and our medical director, Dr. Edgardo Penser.
I will be meeting all of you very
Yeah,
soon.
hopefully.
I'm your friend friendly neighborhood DJ.
I just hope it's not for bad things.
No, ano to, recovery to ano. Ganun.
Yes, yes.
Road to ano to, road to ano. Guys, thank you so much,
Thank you.
doctors. You've earned it.
Definitely.
This has to have a part 2. Again, we're neighbors. Doc Ryland,
Not
I
a
will see
problem,
you
yeah.
very, very soon.
Yes.
Hang on tight for the boys. I keep forgetting to ask them who they'll have tonight, but I'm sure it's going to be a whole lot of fun, like this segment, Healthline. We'll be back next Wednesday. Good night, everyone.
Night.
Good night.
Magic 89.9.